Hi, everybody. So excited to have you joining us today. You might recognize our presenter today, Dr. Scott Munsterman, who is here to give us an update on all things COVID-19. We are heading into the fall. We know there's a lot of anticipation, anxiety, probably, if I'm going to be real honest, about what we're facing in the upcoming months. And then there's been so much information that has come out in the last, really, even in the last couple of weeks. So Dr. Munsterman is here. He's going to share with us all the most up-to-date information, answer the most common questions that we are getting on a day-to-day basis from you about what to do in very specific situations that are happening in the clinic on the day-to-day. So Dr. Munsterman, thank you so much for once again being our go-to man for everything COVID-19.
Yeah, well, it's always great to be with you, Christy, and and just like you said, I mean, we've been learning more and more, especially over the last couple of months, and it's not just us; it's the CDC and understanding the COVID-19 situation better. Not that it's completely figured out by no means, but they've been issuing guidance and updates to guidance almost every single week, and we just thought it would be good to kind of hit the reset button a little bit and talk about some of the things that have been updated over the last couple of months, as you said, Christy, and especially some of the frequently asked questions that we end up getting overall. And so as we jump into this, probably the biggest area that has changed has been the guidance for healthcare workers that are exposed to airborne pathogen. And there are links in this PDF. And so please get the PDF, get it downloaded, dig into the links, do some extra reading. It definitely will be worth your while to get a good grip on the concepts and just the principles that are behind these guidelines that the CDC has put out. And of course, OSHA has been a part of that. And so the CDC, and I have this statement up here because it's one of the first statements that they make. They state that to ensure continuity of operations of essential functions, and of course, early on in this whole thing, that was one of the questions: is chiropractic practice part of an essential function? And I believe we had a couple of states weigh in and said no, but the Fed said yes. And so yes, we are regarded as essential functions in regards to the federal government, and the CDC advises that critical infrastructure workers, which is what we are as chiropractic clinicians, may be permitted to continue work following potential exposure to COVID-19, provided they remain asymptomatic and additional precautions are implemented to protect them and the community. And that's what we're going to talk about today. And, you know, the first thing that I thought would be good to talk about, there's a few definitions that you will see these words pop up. And so, for instance, potential exposure, well, what does that mean? Well, this is the definition. Being a household contact or having close contact within 6 feet of an individual with confirmed or suspected COVID-19. The time frame for having contact with an individual includes a period of time of 48 hours before the individual became symptomatic. So that's what potential exposure means. And as clinicians, we've had potential exposures, no question about that. Now, prolonged exposure, which is also used in these guidelines, the term, is exposure of 15 minutes or more. However, any duration should be considered prolonged if the exposure occurred during performance of an aerosol generating procedure. And so if there's aerosol generating procedures involved, it's not 15 minutes. Any exposure is prolonged, considered then. But otherwise, prolonged exposure is exposure of 15 minutes or more. And then close contact, you'll hear that used periodically. And there's two parts to the close contact. First of all, being within 6 feet of a person with confirmed COVID-19, okay? Close contact, being within 6 feet of a confirmed COVID-19 situation, and then having unprotected direct contact with infectious secretions or excretions of the person with confirmed COVID-19. And so those are just some definitions you may want to come back to as you read through the CDC guidelines. Now, the guidance that they give for us as clinicians and as staff are across the board have been provided, generally speaking, over the last few months. Matter of fact, when we first started talking about this, back in March, I believe it was, when everything came out, that we started talking about, hey, we need to make sure that we do screening on patients. We need to have some monitoring and all of that. Well, these 5 key areas should be getting done within your practice, all right? The pre-screening, meaning that you should be measuring your staff's temperature, assessing their symptoms prior to them starting working, and ideally before they leave. And if there's any change in symptoms during that time, then they need to be referred and see their primary care provider. That's what's called self-monitoring with delegated supervision, and that's when we have some oversight with our staff, with our employees, with the doctors that are within the clinic. Wearing a mask. The employees, doctors need to be wearing a face mask at all times while in that workplace, and being able to provide that personal protective equipment to your employees. The distance, trying to keep that distance at that 6-foot point, and watching that within the clinic and the flow, and then of course disinfecting, cleaning workspaces as well. In the common touch areas, as well as generally speaking, terminal cleaning at the end of the day. We're not going to get into those in particular detail, but these are the things that need to be occurring right now within the practice. And I'm confident that the vast majority of the clinicians are doing those things and need to continue to do those things. So let's take a look at what are the levels of risk, because this is what's been updated by the CDC in terms of levels of risk for staff and doctors as COVID-19 continues to be an issue. And so this interim guidance, you can click onto this link. It'll bring you right to the web page that will help walk you through. And essentially this exposure, it used to be that there was limited exposure, no exposure, mild, moderate, and severe. Now they've got it boiling down to essentially 2 key areas. For a healthcare personnel that has had prolonged close contact with a patient, okay, there's the words for us, or a healthcare provider with confirmed COVID-19. If that individual was not wearing a respirator or a mask, not wearing eye protection, then they need to be excluded. But for everybody else, if you're screening out those patients, if they aren't confirmed, then you are looking at following the recommendations that we provided already in the screening elements of it, and continue to screen patients, wearing face mask protection as well. And making sure that we continue to document this whole COVID experience. And so that means documenting our patients' symptoms and temperatures, just like we're doing, and going into the patient file. Making sure that if there is a reported symptomatology, that we need to carry that forward and refer them on to their primary care provider, and of course notifying the public health authorities. Document your infection control procedures. That's your daily checklist we talked about in the past, and then again monitoring your doctors and staff, assigning any risk exposure that could be a potential within the role that they serve. And that should be kept on record, okay? Because that is a part of the individual's employment record of their personnel file, but it's separate from the personnel file, and it is an employee health file. And so keep that in mind, and that's how OSHA likes to see them separated out. And then, of course, following the return to work guidelines. Having this monitoring system in place, again, making sure that we have an established point of contact, that if signs and symptoms do develop that are compatible with COVID-19 disease, that we make that referral to primary care. These active links help you determine which public health authority that you need to connect with and communicate with. Travel. This has been recently updated as well, and that community and travel associated exposure must be reported by doctors and staff with monitoring. And you can go right into that link, and it'll give you really good detail as to the international travel or even the domestic travel requirements that if you're out and about and traveling, that you take a good look at that and understand how you need to handle that from a guidance perspective. And the U.S. government has recommended that travelers stay home, for instance, voluntarily for 14 days after traveling to the United States from other countries with widespread ongoing transmission, or on cruise ships or river cruises. And then, of course, individuals with confirmed or probable COVID-19 should delay travel until they meet criteria for discontinuing isolation. And we're going to talk about that in just a few minutes, about how long do we stay isolated, that type of thing. If they've been exposed to a person confirmed with COVID-19, they should delay the travel until 14 days after their last potential exposure. And so the details there in terms of domestic travel and international travel have been probably more clarity around that in regards to how the CDC has put that forward. Now, as we've talked about already, that self-monitoring with delegated supervision is what you are participating in doing within your practice currently. And so, again, when staff and doctors are scheduled to work, making sure that we assess symptoms, temperature twice a day, beginning of work shift, after work shift, and then, of course, anything occurs during that time to make sure that that is noted and reported. And we have provided these on downloads to you in previous webinars to give you a good running start as to how to keep track of that with your employees. So, the question has come up many times over the last couple of months in particular, probably more so the last few weeks that we fielded. When can employees who have had COVID-19 or illness consistent with COVID-19 come back to work? And so the CDC has laid out this guidance, and you can click on this link here, and there's a couple of different strategies that they had provided earlier that they now have recently changed and have updated just over the last week and a half to 2 weeks. And so previously they talked about a symptom or time-based strategy, and then also a test-based strategy, in that we had the choice between the two. Well, what they've come out with now is that they're not recommending the test-based strategy, and they have changed and updated the symptom-based strategy as being the primary return to work guideline. And they've also defined it in 2 ways. And so as we take a look at these guidelines, healthcare personnel with mild to moderate illness, and we're going to define that in just a minute, who are not severely immunocompromised, at least 10 days have passed since symptoms first appeared, and then look at the word "and," okay? And at least 24 hours have passed since the last fever without the use of fever-reducing medications, and symptoms have improved. And so those are the 3 requirements that need to be met prior to allowing staff to return back to the practice if they have had COVID-19, and if they have been considered to have a mild or moderate illness. So what does that mean? Well, mild illness, and this is the definitions here: individuals who've had any of the various signs, symptoms of COVID-19, those symptoms we've talked about, without shortness of breath or dyspnea or abnormal chest imaging. That would be considered mild illness. Moderate illness would be individuals who have evidence of lower respiratory disease, and then, of course, severe, much more detailed and critical illness verified as well. And so with mild, moderate illness, again, we're looking at that symptom-based strategy of at least 10 days, kind of the 10-day, 24-hour rule, symptoms improved, okay? And that's how you can think about that and remember that. And so when we look at the severe to critical illness, who are severe or who are severely immunocompromised, then it changes to the 20 and 24-day rule with symptoms improved. And they found in the research that they need at least that 20 days because of the viral shedding that occurs. And typically by 15 days, they found in the research that most of the people, the coast is clear to go back, but 20 days nails it from that perspective and after the onset of symptoms. And so there is no more replication competent virus, they call that, that occurs past that 20 days. And so that's what they've learned with the severe to the critically ill with COVID-19. And again, the test-based strategy for returning back to work, except in rare situations, test-based strategy is no longer recommended to determine when a healthcare personnel can go ahead and return back to work. And so, again, change just occurred over the last week to 10 days. Important to know because, those guidelines are updated. So then what happens when they do come back to work? Is there anything different that we need to do? Well, after returning to work, the healthcare personnel need to work, pretty much do everything that we've been doing before, right? Wearing a face mask, doing all of the screening requirements, being able to continue with the cleaning operations and the distancing. And so all of these things need to be continued, self-monitoring for symptoms. And then if there is any change in the symptoms or an increase in the symptoms, even following having been off and had COVID-19 and gone through that, then that would need to be reported in the event that would happen. And then, of course, the isolation and precautions that need to be taken into consideration for anybody. And as you think about the overall exposure, for most persons with COVID-19 illness, isolation and precautions can generally be discontinued 10 days after the symptom onset and resolution of the fever for at least 24. And again, it reverts back to that 10-day, 24-hour rule, and to keep that in mind. So let's talk a little bit about exposure control and protection from the airborne pathogen. And at the end of the day, it's all about creating and maintaining that safe clinical work environment. And the concept, again, that we always have to have the mindset of is standard precautions, or what's called universal precautions. And that means that we assume that everybody that walks in the office is potentially infected or has a pathogen colonized within them. And so we have to have that mindset. It always keeps us at the top of our game and at the edge of our seat at times. And we want to make sure that our staff and doctors within the clinic facility are trained properly in performing safe work practices. Of course, that means using personal protective equipment, whether that's the face mask, as well as any cleaning that is done using gloves, making sure that it's disposed of properly, making sure we practice proper hand hygiene, cleaning. And then, of course, face masks. This is a new CDC website that they put out there, some considerations for wearing face masks, and talking about how important face masks are. They also talk a little bit about face shields and how the research has, and they cite the references, by the way, for those of you that are interested in taking a good hard look at that. What's the research behind face masks? They've got some very good references about what they've learned to date now by using face masks. And of course, the shields have not proven themselves at this point in time. And so face mask is the best to implement in terms of personal protective equipment. Now, we have to ask the question, who should not wear a face mask? And so children younger than 2 years of age, anybody that has trouble breathing, and of course, anyone who's unconscious or isn't able to remove the mask without assistance should not be wearing a mask. And then under exposure control, again, that's why we do our screening. That's why we're doing our clinical assessment of our patients, is all part of the exposure control plan that's in place. Another great question is, what's required in my practice when a patient has a positive screening or a test for COVID-19? And this is, I almost took this question out because I think it's been answered over and over again, but I put it back into the presentation, and our responsibility is to send the patient to primary care and have a diagnosis, be evaluated, but then also to report to your public health authority so that they can begin their monitoring system and their tracking, and each region is different. And we've already provided an earlier link on how you can find your state or local public health authorities. The link is also embedded here in this particular slide. And once a patient or individual has been referred and has been public health has been notified, they become a person under investigation, and that's what that's called. And that the public health authorities then take it from there, and then they follow and track and trace and try to help understand what type of potential exposure has there been up to this point in time. So your reporting responsibility at this stage of the game ends at that point. You've made the referral, you've reported to public health authority, you've documented that situation within your practice. So how should I respond if a patient has been determined to have COVID-19 and they've been in my office? Well, the CDC made this comment quite a while ago, is that CDC does not recommend testing, symptom monitoring, or special management for people exposed to asymptomatic people with potential exposures. Now, keep in mind, we're talking about asymptomatic with potential exposures. It's not people that we know, have COVID-19. All right. So, and what they're basically recommending is that it's important to, again, early identification of symptoms, screening appropriately, and then acting on that moving forward. Another question we've had is, when is it safe for the patient to return to the office for care? Great question. And essentially, it's the exact same guidelines that it is to return to work. And so you've got your 10-day, your 24-hour rule, if you will, with symptoms improving. And then, of course, this is the same rating, that mild to moderate illness classification in this approach. And then, of course, if it's more severe to critical illness, then we have the 20-day, 24-hour rule with symptom improvement. And so you can be thinking about those things in terms of asking patients, when patients call, can I come back to get treated again? Then the big thing here is to make sure that you follow the symptom-based strategy so that they understand when they can discontinue that transmission-based precaution that has been put into place. And of course, appropriate cleaning and disinfecting, that's all a part of exposure control. And then regulated waste is another key aspect. I mean, where do you throw the stuff that has potentially infectious material on it that you've cleaned maybe a table with and paper towel? Or where do you throw your gloves that you use to do some cleaning? Or where do you throw that used face mask maybe at the end of the day? Well, it needs to be in a regulated waste container or bag that has a warning label on it, or use a red bag. And this is a requirement by OSHA, so that everybody knows that has contaminated waste within it. And then just a few more questions, frequently asked questions. Can employers conduct worksite testing? And yes, they can. They can conduct that. They can consider implementing strategies to reduce risk to safety and health of workers and in their work environment, the clinical work environment. OSHA does not prohibit employer testing, and so it's all about early identification, exposure control, right, and being able to get that accomplished. And certainly if testing is a part of your procedure to do that, that's all right to do that. Can employers conduct work site temperature checks and other health screening? Yes, they can. And of course, we just got done talking about doing these things. This guidance, frequently asked question guidance, came out about a week ago, and this just kind of nails it for us that yes, this is there. It is fine to be doing that. What OSHA requirements must an employer follow when conducting health screening, temperature checking, or COVID-19 testing? And of course, what they're following then is the employee exposure and medical records standard. Okay. And that's all, and we're going to cover some OSHA standards here in just a few minutes to show you how OSHA is covering the exposure control part of the regulatory environment within a business or a healthcare facility. And what's important to understand is that, as we alluded to earlier, your staff person or your employees have a personnel record, but now because of COVID-19, they have an employee health record, and that's where you keep track of the health screening or any types of infections or any types of incidents that may go on, and that falls under the 29 CFR 910 1020 standard and their exposure to that. Is there guidance on how to address the various health screening and medical issues associated with COVID-19 to avoid violating other labor, disability, and employment law? Under the EEOC, employers are encouraged to review the guidance as they develop health screening and work policies and return to work plans and all of that. And this particular guidance lays out very well that we can move forward under the understanding that we are doing everything we can to limit the exposure of these airborne pathogens, and that includes the screening and all of the other safe work practices and training that we've talked about. How do I know if employees need personal protective equipment? And that's part of your hazard assessment. And of course, we know that because of what we've learned and what the CDC has put forward in terms of guidelines, as well as OSHA, that with airborne pathogens, that using face masks to date have been demonstrated to help curb that and lower the risk of infection. And so it all boils down to having a safety and health program at the end of the day. And OSHA has provided us some pretty good guidance as to how they view the world in looking at just the airborne pathogens. And this question was also in frequently asked question: does OSHA's guidance for healthcare apply to healthcare provided outside of hospitals? And I thought this was really interesting because their response was yes. OSHA's guidance for healthcare applies to other types of healthcare and healthcare support services, including home health, physical therapy, occupational therapy, and chiropractic care. And so they actually named chiropractic care and seeing that was significant to be able to do that. So, well, what are we under? Well, let's take a look at that. Under OSHA, and with the airborne pathogen that we're talking about, COVID-19, all of these different regulatory or regulations, that is, have a role in an exposure control plan or a safety and health plan just for airborne pathogens or COVID-19. It's record reporting. We talked about the medical records of the employee, hazard communication, sanitation, respiratory protection, personal protective equipment standard. And so all of those standards apply in some degree to this COVID-19 situation. And how we do our training and our housekeeping and our control measures in terms of how are we limiting the exposure within the practice. What does our policy look like? All of that. And OSHA looks at those types of requirements as being significant to help lower the risk. We've got a hazard out there. It's called an airborne pathogen called COVID-19, giving COVID-19 disease. All right. And so we know that's out there, but there's two things that we have to consider with that. Number one is the exposure, and the higher number of exposures you have, guess what? The second thing is risk. The higher number of exposures you have to a hazard increases your risk for disease. And so it's all about identifying the hazard. How do we limit exposures in order that we have a lower risk? And that's what a safety and health program is all about, whether we're talking about airborne pathogens or anything else. And so if you need help in establishing OSHA safety and health program, happy to talk to you more about that at any time. I know, Christy, we've provided in the past, and it's been a while since we've talked about COVID-19 and all of this. We provided in the past some helpful checklists and information and all of that. And I'm sure we could make that available to everybody again if they missed out on that opportunity before.
Yes, we can. I'm putting the link to all of our COVID resources on the chat box right now, except I put COVID, not COVID, so y'all forgive me, and my haste of typing, but that link will take you to the ChiroArmor COVID-19 resources page with numerous handouts, previous webinars that we've done. And you'll also see, like, for specific OSHA downloads and things, there's a tab at the top you can also download for that. We did have one question came in that if an employee tested positive and the doctor is still awaiting results, does the office need to close until the DC tests negative?
So if the doctor has symptoms, then yes. If the doctor is asymptomatic, then it's regarded as a potential exposure. Okay, and so make sure that you follow all of the guidelines that we've talked about, and monitor your symptoms, or monitor your temperature. If anything changes along those lines before you get your test results back, then yeah, you're out. But if you're asymptomatic and your testing, or excuse me, your screenings are fine, and you're performing all of the all the things that we just got done talking about to reduce the exposure, then you can continue along those lines because you've been potentially exposed.
Love it. Let's see. I have a lot of thank yous in here. I don't see another question. So if you have another question for Dr. Munsterman, please go ahead and submit it now. Let's see. I was going to bring up, we didn't really talk about OSHA. I mean, we talked about OSHA, but we didn't talk about OSHA a whole lot. It's like my new favorite topic of the year, because Dr. Munsterman and I have both been talking about OSHA for a really long time. And the most common thing we hear at an event is, well, that doesn't apply to a chiropractic office. And as we realized, that's definitely come up in conversation a lot lately, because we found out real quick in March that yes, it absolutely does apply to us. So we definitely need to have OSHA policy in our practice. Is there anything else that you want to add to that, Dr. Munsterman? And
No, but to your point, Christy, it's very clear, and they actually even call us out, which is fine. We are healthcare providers, and we operate within the healthcare delivery system, and as you download the PDF and you begin to look at the OSHA regulations, the CFRs that are encompassed around just the airborne pathogen, these 3 slides kind of tell it all. I mean, these are the areas that we have to make sure we have in place, and of course, as we've talked about in the past, Christy, I mean, having a good safety and health program is a necessity in a chiropractic practice.
absolutely. So we had another question that came up, and she said, what are the situations where we would have to close our office down?
Well, I guess the situation I would think about would be that if the doctor tested positive for COVID-19 and they can't practice, they've got to be in isolation and take care of themselves, and that could potentially close the clinic down. If all of your staff were out at the same time and it's just you as the doctor, that could potentially. So it's more along the lines of a staff shortage issue, resource issue for you and your practice. So if we can keep people healthy and keep COVID-19 at bay, kind of thing, and just keep moving along, hopefully that'll keep you open.
Absolutely. I did post the link. We have a free guide from a previous OSHA webinar to help you to establish an OSHA policy for your practice if you have not already. So I popped that link up in the chat box. So if you do not have OSHA policy yet, make sure you go to that page and download that guide and start working on it. Dr. Munsterman has broken it down. It's like a step-by-step guide to help you get there. So definitely check that out.
And Christy, I believe ChiroArmor's offer is still on the table for doctors to take advantage of, and maybe you can send them a link for that. What we've done is we've severely discounted our OSHA program for the profession at this point. We thought it would probably be a couple-month thing, but this is getting to be a longer gig than what I think anybody anticipated. And so We do have heavily discounted our OSHA program, and doctors that have purchased it and that we've worked with have been very grateful for that, and it's worked out well for them. So.
Absolutely. And that link, when they click on OSHA, it's going to give you the opportunity to download the white paper to create your own manual, but it's going to pop up and say, hey, this is what Dr. Munsterman does. Like, he is the compliance man, and helps people to build compliance policies for their practices, manage that. In fact, sometimes he's even the compliance officer for that practice. So it's going to pop up because that is like a $1,500 program that ChiroArmor does sell, but it does have a coupon code, COVID-19, that gets it for you at 90% off at $149. So, this is a great question. Does the office need to call past patients and warn them that they may have been exposed?
No.
Yeah.
Your reporting requirements are to the public health authority if you have a positive screening, and referring that individual to primary care for further testing. So. And I see a lot of those questions are all pretty much the same. I think that'll probably answer that.
Yeah, so I see that there is a lot of questions about that. So I see there's more questions too. It's like, if you have a patient that tells you that they tested positive, do we need to be tested?
No, it's not. You can if you want to be. I mean, anybody can be tested if they want to be. It's only, the results are only good for that day that you were tested. So just always keep that in mind. But if it gives you maybe a little bit of peace of mind, that's fine. But the key here is to continue to screen yourself. It's that supervised or monitoring under supervision, and you want to make sure that you're doing your symptom screening, your body temp screenings, beginning a work shift and a work shift. That's the key.
Absolutely. And I think that at least I know several people who've spent hours waiting to be tested. But they waited until they had some symptoms, which basically is like any symptom under the sun, from allergies to food poisoning. So if you definitely have those symptoms, if you're feeling fine, I think if you just want to be careful, just say sorry, but I will tell you that it takes forever to get those results, at least in our area. I don't know about you, Dr. Munsterman, that it's been taking 10 plus days for us to get results back here.
Yeah, it depends on the geographic area.
It does. What else y'all got going on? Anybody? So again, there was a lot of questions about, do y'all need to inform patients if they've been exposed to a positive person? And again, Dr. Munsterman said you report to the health department. Correct, Dr. Munsterman?
Right.
Not to your patients.
Right. If you have somebody that you screened and they test positive, you're referring them out to their primary care provider for testing. But then you're also letting your public health authority, local or state, whatever the protocol is for your region, know that, so that they can become a person under investigation that then the public health authorities monitor and trace and do all of that. So that's your reporting requirements to date.
Yes. So if y'all have any more questions, go ahead and submit those now. Know that if you are watching this recording, like so many people do on our webinars, and you submit a question through the chat box, it will send me an email immediately upon hitting that little arrow to share it with me, and I will be sharing that with Dr. Munsterman. We'll email you back with your answers. And this is going to be a lot of COVID talk this month, and probably in the next couple of months, as everything is changing. So be on the lookout for new webinars. Next week, we have Dr. Jay Greenstein and Brad Cost, and they're going to be talking about how healthcare practices have been affected by COVID. And this is not speculation. This is not their opinion. This is based on the data that has been tracked across the country and how it has impacted practices from the beginning of this year, prior to March when COVID hit, to now, and what they're seeing, and based on that information, what they're anticipating for this fall. So that ought to be a very interesting webinar to watch if you have not already. We'll also be having Don Rasmussen come back to talk about the loans and what you need to do now that it's time to report back, how that money was spent, ensuring loan forgiveness and all of those things. So he'll be back coming in later this month. And then just because it's not COVID related, it's just chiropractic paperwork related, there is a new ABN form, if you have not heard, that goes into effect next month or at the end of this month. And Dr. Evan William is going to be here to talk to y'all about that new form, what you need to know. Make sure you're making those adjustments and changes in your office ASAP. Oh, this is a good question. When would a clear face shield be necessary?
Yeah, there was just some, and I go back into the PDF. I'm going to find that right now because I did make a comment about that the CDC, right here. So if you go to this link right here, it'll bring you right into the web page that the CDC put out, and of course they have some different references to face masks, all that. They made a comment about face shields not being proven yet. And so the question is, when is a clear face shield necessary? And I would tell you, based on what I know today, I would have to tell you that unless you have something that you're going to have like splatter for eye protection type of thing, it's probably not going to be the best in terms of respiration, inhaling, exhaling. And so if you're going to be exposed to any type of excretion or secretions that could be splattering in your face, then wear a face shield. But I would probably recommend wearing a face mask as well, based on what I read. So you can open up that link and read some of the new information that CDC has put out there. But that would be my interpretation today.
I have to say that I'm super glad that somebody asked that question, because I flew this weekend to attend a convention in Missouri that was still live and in person. And when I was on the plane, I saw several people with face masks instead of, or face shields instead of masks. And I thought, well, obviously it's easier to breathe, but exactly how effective is that? And that thought did cross my mind when I saw them. So new question. If my employee called off today with fever and a sore throat, do I need to do anything specific in terms of my office besides having her stay home until a negative test is received?
Yeah, well, what you'll need to do is go ahead and report that to the public health authority, that individual, and then exactly what they're, referencing there is that, yeah, they need to be tested, and if it's a negative test, then certainly she can come back. But that would probably be the only step that I would take, then, would be just in addition to that, since this individual is a healthcare personnel, that the public health authority should be aware of that there's a positive symptom screen and that a test is underway, and then they can follow up with that.
So this is an interesting question that just came through. So this clinic had a patient who went to their MD to get tested, but they had also been in her practice, apparently, and wants to know, does she need to report that patient because she had also been in her office, possibly with symptoms, or is her MD going to report that?
Yeah, well, the rule of thumb that I've provided for advice is, when in doubt, just go ahead and report it.
I like that. Okay.
They go to their medical doctor and they're getting tested and all that. There's a really good chance that it's been reported. But in terms of doing our job, if you end up reporting something twice and they've already been reported, that's okay. And you get into the practice of doing that. And I think that's important, and not assuming that it didn't go, reported.
So is there any situation where a practice would need to inform the public? Okay.
I love health authorities authorities. Yep, I know there's lots of questions. It's like same answer. Public health authorities, that's their job. That's what they're doing. They're doing their tracing and tracking and having people under investigation, and they're monitoring them closely. And that's their job, is to get that done. And so that's our reporting responsibility at this point.
I love that all of y'all are asking questions and wanting to make absolutely certain that without a shadow of a doubt, you know what steps you're supposed to take, because it means you care and you're doing everything you can to protect your patients and your team. So I think that's fantastic. Yeah. Let's see. All right, guys, I'm going to give y'all another minute to pop in another question while we have Dr. Munsterman's undivided attention. If not, I'm going to close it down. You're going to have to email me with your questions and wait for that answer. And that gives y'all an extra 15 minutes to breathe before seeing patients again. It's like a good news day. All right, everybody, that's it. Nobody asked another question. So I am going to let you go. So again, just a reminder, next week, we're going to be talking about the impact of COVID on practices across the U.S. It's going to be fun. Well, maybe. It should be very interesting, but Brad and Dr. J are super fun, so it should be interesting and fun, let's be honest. If we're not having fun during all this craziness, why not? Let's just do it. Like, have fun and ride this crazy wave. We'll be talking about it for years to come. So I hope you have an amazing rest of your day, a fabulous week, and I will see you next Tuesday.
Thanks, Christy.
Bye, y'all.